This module will help you to understand the principles of effective youth participation. There's lots of different theories about youth participation and about what makes good youth participation, and as youth advocates it's really important to understand these theories so that you can be effective in your role. Youth participation is about involving young people in an organisation structure, giving them decision-making power and allowing them to have a say in the issues that affect them. It can involve a range of different consultation, feedback and decision-making activities, ranging from passive kind of feedback all the way through to active decision-making. Youth participation has a range of different benefits for the individual, for the organisation and for the community. At the organisation level, youth participation makes sure that services are responsive and relevant to young people. At the individual level, it's about empowering young people to have a say in the decisions that affect them, and it can have a range of benefits for a young person's well-being, improve their mental health literacy, increase their social connectedness. And for the community level, it can increase young people's capacity and allow them to be active and engaged citizens within their community. One of the most well-known theories of youth participation is Hart's ladder, and it's a ladder that represents youth participation from the lowest rungs of the ladder being the least active through to the highest rungs of the ladder being the most active forms of youth participation. Let's have a look at the ladder. Each rung of Hart's ladder represents increasing levels of participation. Hart calls the lowest 3 rungs on the ladder non-participation, where young people's involvement is not genuine or meaningful. Rung 1 is where adults have complete authority and abuse their power. They use young people's voices and ideas for their own. An example at Headspace would be if resources and fact sheets were developed that include illustrations done by young people, but young people are not consulted or acknowledged. Rung 2 is where young people take part in an event with very little involvement in the decision making. So an example would be if a young person was given a script by adults to use for a health promotion video. The third rung is where young people are given a limited voice and choice about what they can say and how they can communicate. So an example at Headspace would be if young people were sitting on panels at conferences without the opportunity to understand the role beforehand or to consult with adults. Rung 4 on Hart's ladder is where adults decide on the project and young people volunteer for it. Young people understand the project and adults respect their views. So an example at Headspace would be young people sitting on interview panels and supporting Headspace with the recruitment of staff. Rung 5 is where young people give advice on projects designed by adults and receive feedback on their ideas. So an example at Headspace would be involvement in the design and development of Headspace advertising campaigns and marketing material. Rung 6 is where projects are initiated by adults, but the decision making is shared with young people. So an example at Headspace would be consultation with young people regarding the development of the eHeadspace service. Rung 7 is where young people initiate and direct the project with support from adults. So an example at Headspace would be youth reference group community awareness projects, peer-to-peer training, and youth mentors or youth advisors. Rung 8 is where projects are initiated by young people and decision-making power is shared between young people and adults. An example at Headspace would be youth-led health and wellbeing projects and youth-initiated health promotion activities. Headspace aims to practice youth participation at the top 3 rungs of Hart's ladder. Headspace practices a youth-centred approach to youth participation. This means that young people are meaningfully and actively engaged in all aspects of Headspace service design and delivery and work in collaboration with Headspace staff. We recognise that young people are the experts in youth health issues. Headspace aims to provide young people with meaningful opportunities to be engaged across all levels of the service. This could include being involved in service design and delivery and collaborating on young people's campaigns. Headspace aims to practice youth participation according to 7 guiding principles. A youth-centred approach. Headspace has a youth-centred approach to youth participation, engaging young people in shared decision-making about the service. Meaningful participation. Headspace empowers young people by providing them with meaningful opportunities to engage with and provide input into Headspace services and their communities. Collaboration. Headspace staff and young people are equipped with the skills and platforms that they need to engage and collaborate with each other. Learning. Headspace supports young people in their participation roles by providing training and development opportunities. Resources. Headspace allocates resources to support youth participation, including staffing and funds to provide training and support to young people. Diversity. Headspace engages a diverse, representative group of young people in youth participation. Barriers are challenged. Headspace acknowledges and addresses barriers to youth participation identified by Headspace staff and by young people. The Headspace Youth Participation Handbook provides more information and some guidelines and advice on how you can put these principles into action.